We've learned a lot about ovarian cancer, more than we have about breast cancer in the last, since the cloning of the genes. And I wouldn't have expected, they were cloned in the early 90s, and the epidemiologist said, oh, the field is gonna break wide open. I didn't understand how and why, but it is. The biology of it it has revolutionized the biology. Identifying the mutation carriers, who makes you at risk, led us to eventually, to what the mechanism of action of these genes are, what were they for, and they're DNA repair genes. The BRCA genes are involved in DNA repair. So if you don't have them, you're more prone to develop tumors in certain organs. We don't understand what actually causes that. But also, the tumors that arise without the BRCA genes cannot repair the DNA damage. So they respond better to tumors. And now we understand why the platinum drugs are like gangbusters in ovarian cancer, which they always have been. That was the first therapeutic target for cisplatin when it was introduced, other than the more rare germ cell tumors, where they wiped them out. I mean, the signal was very strong from the beginning with germ cell tumors. But the other thing that we learned about the biology is, if we wanted to prevent the cancer, a lot of women elected to have risk-reducing surgery, because there was no way of identifying the ovarian cancer early. There's a way of identifying breast cancer early, but there was no way of identifying ovarian cancer early. People were trying. But so from these risk-reducing surgeries, it's obvious that ovarian cancer, a lot of times does not start in the ovary. It starts in the tubes. It starts in tubes, which has great implications to the biology. First of all, the ones that start in the tubes are high-grade serous. And high-grade serous are the majority of the ovarian cancers, but they're not all of them. But the high-grade serous, they all have certain common defects. The other thing is high-grade serous, well, if they start in the tubes, they get to the ovary. Well, they get to the ovary they are very close, but they also jump from one organ to another, and they like the peritoneal cavity. That's a great environment. They spread in the peritoneal cavity. So all of a sudden, it's given us an idea of why we had all these difficulties before, how to guide the therapeutics, and also to focus on the molecular subtypes.